Hi, good morning, Michael. My name is Mihira. I'm your invigilator for the OET-speaking session on the 13th of June 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record?
My full name is Michael Rosewood.
Michael, what is your candidate number?
My candidate number is 276327763.
Okay. Are you taking this test as a nurse?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
What did you like least about your last job?
There was nothing I really hated. Sometimes, we would be a little short of nurses on the unit, and I remember a couple of nurses were not pulling their weight as much as they could. As a result of having to bear the additional burden, my responsibilities were a bit more taxing than they should have been. After about 6 months of this, I was beginning to feel a bit worn out and worried that I wasn't giving my patients the care they deserved. So, that was a little vexing. But, as I already said, I never disliked or resented my work.
When were you the happiest in your job?
I feel satisfied while talking to the patients and making them feel comfortable. I'm happy when I know I'm doing a good job for them and giving them the greatest care possible. When a patient appreciates or smiles at me, it brightens my day.
What do you feel you contribute to your patients?
I provide all of my patients with the best care and advocacy I can. It's important for me to ensure that my patients are always comfortable and confident in my abilities, so they know they are being looked after properly. Also, I will act as their advocate, if necessary, and give a voice to any concerns they may have about their treatment.
Have you ever had any differences with nurses you have worked with?
I once worked with a nurse on a pediatrics ward, and we simply didn't get on with each other. It was just a clash of personalities. After about 3 months, it was becoming almost impossible for us to work together, so, finally, I pulled her aside and asked her to have a quick coffee after work and find out what was wrong. It turned out she was just communicating differently with nurses in her unit in the past. After we talked about this for about 15 minutes, we actually began laughing at what we both perceived to be slighted on each other. We ended up working it out, and we're very good friends now, believe it or not.
How do you feel about CO workers and supervisors, WHO come to work late, leave early, or take long breaks?
That is unacceptable to me. To run the institution and ensure the patient's well-being, we must all work together as a team. I would not put up with other nurses or supervisors arriving late, leaving early, or taking extended breaks during working hours. The sooner we can get everyone started on their given shifts, the better it will be for everyone.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Good morning. I'm Nurse Michael Rosewood, and I will be attending to you here today. What brings you to the clinic today?
Well, I've been feeling a bit tired and dizzy lately, and my doctor suggested that I should get a blood test and a fasting pressure check.
I see. Well, may I know your name, please?
My name is Mihira.
Mihira, it would be great if you could give a brief explanation about your general health.
Nurse, I am leading a sedentary lifestyle, but I am generally healthy. To date, I am not having any particular health condition, and I am not on long-term medication.
That's good to hear. And Mihira, do you have any allergies that we should know about?
No, not that I know of. I take some painkillers, sometimes for my back, but that's it.
Okay. And what do you do for a living?
I'm an electrician. I work mostly indoors, fixing wires and appliances. It's not very physically demanding, but it can be stressful sometimes.
I understand. And how about your diet?
Well, to be honest, I don't have much time to cook, so I usually grab something from the nearby fast food joint or order pizza. I know it's not good for me, but it's convenient and cheap.
Well, one of the things we're going to test today is your cholesterol level. Do you know what cholesterol is and why it's important to check it?
Not really. I've heard of it, but I don't know what it does or how it affects me.
Well, cholesterol is a fat-like material that is present in your blood and most tissues in your body. It helps to make hormones, vitamin D, and bile acids that help you digest fat. However, too much cholesterol can be harmful, especially if it accumulates in your arteries.
What do you mean by that?
Well, Mihira, I will explain it to you in detail. There are two types of cholesterol: high-density lipoproteins, known as HDL, and low-density lipoproteins, called LDL. HDL is also known as good cholesterol because it helps to remove excess cholesterol from your blood and prevent it from sticking to your artery walls. LDL is also known as bad cholesterol because it can deposit fatty plaques in your arteries and narrow them down. This can increase your risk of developing heart disease or stroke.
Oh, that sounds serious. How can I tell if I have too much LDL or not enough HDL?
Your question is valid. That's why we need to do a blood test. We can measure the amount of HDL and LDL in your blood and see if they are within the normal range or not.
I see. And what can I do to improve my cholesterol levels if they are not normal?
That is a good question. Mihira, there are some lifestyle changes that can help you lower your LDL and raise your HDL. Mainly, focus on your diet. Eat more fruits, vegetables, whole grains, nuts, and fish, and avoid foods that are high in saturated fat, trans fat, salt, and sugar. Apart from that, you can exercise more regularly, at least 30 minutes a day. Quit smoking if you smoke, and limit your alcohol intake if you drink.
That sounds like a lot of changes. Do I have to do all of them at once?
No, of course not. You can start with 1 or 2 changes that are easier for you, and then gradually add more as you go along. The important thing is to be consistent and motivated. Remember that these changes are not only good for your cholesterol, but also for your overall health and well-being.
Okay, I'll try to do that. Thank you for explaining everything to me.
You're welcome. Now, are you ready for the blood test? It's straightforward and quick. All I need is a small sample of blood from your arm. Do you have any questions or concerns about the procedure?
No, not really. Go ahead.
Thank you for your consent. After the blood test, please wait here for a few minutes until we get the results of your blood test and fasting pressure check. Then, we'll discuss them with you, and give you some advice on how to manage your health. In the meantime, do you have any questions for me?
No, I think you've covered everything. Thank you for your help.
You're welcome. It was a pleasure talking to you. Have a nice day.
That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihira.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.